Hello everyone, I am Dr.Pranshu Mehta. I would like to welcome you all here on this live session with Nextillo, The Wonder Has a Name. So, first of all, I would like to thank Dr. Sunil Sharma for actually making this platform and making it available for everybody. And even in this situation, when the tables have turned and there is so much chaos going on across the globe, specifically, many FMGs have issues due to many unforeseen circumstances. We are still there trying to support and help. So, we'll start today's lesson. Today, we'll be talking about the anatomy of ear, and in that, also, we'll start with the external ear. That in brief, we'll come to the middle ear, and we'll try to cover up as much as we can so that you develop a concept. The only reason I have written let's earn ENT because to learn ENT, you will need to earn ENT. So you can learn ENT only if you earn ENT. Okay. Wait, I think my camera is not on. I'll just put it on. Just hold for a second. Yes. So I think now, am I visible? So let's start. I hope I'm visible and audible. So as I said, the reason I have kept this as earn ENT because to learn ENT, we need to earn it first. We need to earn by putting in efforts to understand the basics and to understand the anatomy of ear. So first of all, we'll start it from pretty basic thing. When I hear the word ear, what image do form in my own mind, because that becomes very important. Now whenever somebody hears the word ear, this image is what comes to everyone's mind. Now we correlate this thing as the ear. However, once we study, we know that this is just pinna, which is a part of the external ear, which is the part of the ear. So we should be clear that when we are talking about ear has three parts: external ear, the middle ear, and the inner ear. Now, the external ear we can in itself divide into the pinna, the external auditory canal, the external auditory canal, and the tympanic membrane, The middle ear is a 3D space which has the ear ossicles and the middle ear folds, plus opening of eustachian tube and opening of the mastoid. The inner ear can be divided into two, the bony part and the membranous part. Bony part and the membranous part. So first of all, we'll be starting with external ear. We'll try to understand the basic of external ear so that by the time this class is over, you have some idea about ear, its anatomy, its orientation, the external ear, the middle ear. Okay, so let's start. First of all, before moving to anything, I feel the most important thing in understanding anatomy is the orientation of the organ. So in our body, if I am drawing the head, if this is the nose, this side is the nose, this is the top view, you are looking at hair, you are looking at the head of a person. If this is anterior and this is posterior, the ears will be somewhere here, right? Ears will be somewhere here. So the orientation, the pinna is located over here, the external auditory canal will be somewhere here, though it will not be straight. I will tell you exactly how it is placed, but just for orientation part. Then we'll have the middle ear, and then inside of this we'll have the inner ear. So we need to know this basic orientation so that the ear is made like this: external part, middle part, inner part. This is how it will be oriented in our body. Coming to external ear, the external ear has two surfaces. External ear has two surfaces. Now, just look here. If you are considering this to be the ear, this is the opening of the external auditory canal. This surface, where we are looking at right now, is called as the lateral surface, of the pinna. Now, everybody, while reading this, while learning this, touch your ear. The part which you can touch is the lateral part of the pinna or lateral surface of the pinna. Now, hold it from back, try to push it to the front. So we'll hold it from here and try to push it forward. We'll try to push it forward like this. So now we can see this surface. This surface is also called as the medial surface of pinna. This is the medial surface of pinna. So these terms become very important because now whenever somebody will ask you a question, it will be regarding the lateral surface of the pinna or the medial surface of the pinna. Okay. Now this pinna is made up of cartilage. This is made up of cartilage. The amazing thing which can even be asked in the exam is it will be made up of one single cartilage. It will be made up of one single cartilage. In fact, the outer cartilaginous part, the outer cartilaginous part of the EAC, external auditory canal, and the pinna, both are made up of just one single piece of cartilage. It's made up of one single piece of cartilage. Sorry for the interruption. I think I got a call. It's made up of one single cartilage. So here is our diagram. So it's made up of one single piece of cartilage. Now, this cartilage has some elevations and some depressions. It has some elevations and some depressions. This outer curve or outer elevation of the cartilage is called as the crus. This part is actually the crus. This outermost one is called as the helix. Is called as the helix of the pinna. Now this helix, the anterior part, this is the anterior side, this is the posterior side. The anterior part of this helix, which comes here and is attached to the concha, is called as the crus or crux of the helix. There is one more elevation which runs just against or opposite the helix and comes and divides into two over here. This is called as antihelix. Antihelix. Now you see this is one elevation which is coming here and dividing into two. Can you see there is a space formed between these elevations? And what is the shape of the space? Triangular. So this divides the space or the depression into two shapes, boat-like and triangular. This boat-like is what we call as the scaphoid fossa, and the triangular is one which we call as the triangular fossa. The triangular fossa. So best way to remember this: take up your finger, keep it on your ear. This is helix. Just next to it, the other elevation is the antihelix. Now this elevation comes and divides here, forming a depression which is triangular. This depression which is triangular, it is called triangular fossa, and the depression above is called the scaphoid fossa. Okay. Now, just opposite this lies a structure over here, a cartilaginous projection. I think everybody can feel this in their ear. This is called as the tragus. This is called as the tragus. Now, similar to what we have for helix, we have the antihelix. Similar for the tragus, there is a projection just opposite the tragus and goes and continues with the antihelix. This projection over here is called the antitragus. Is called the antitragus. This free part, which does not have any cartilage, is called the earlobe. Is called the earlobe. It is made up of fat. This is the earlobe. Now, this earlobe can be free in some cases and can even be attached in other. It's determined genetically. So these are the elevations. Now, if you see, there are two depressions also. The depressions being here, this depression, till you reach the opening of the EAC here. This depression, it's called the concha. It's called the concha. Now, this concha is being divided into two by this part of the helix. So, what is this part of the helix? This is called the crux of the helix. So, the crux of the helix divides the concha into two: the Simba concha and the cavum concha. The Simba concha, and the cavum concha. Cavum concha. Okay. So, if I were to revise quickly the parts of ear, I'll first of all make one ear myself, label this part as earlobe, which is free. Outermost part, this elevation is what? Helix. Then I'll have a elevation just opposite to this, going and dividing into two. This will be the antihelix. Then one projection will be here, which is called tragus. Just like helix and antihelix, we have one antitragus. Where is the antitragus? It will be just opposite to tragus in continuation with the antihelix. Now this part, which is crux of the helix, will divide the depression over here, which is the concha, into two: the Simba concha and the cavum concha. Here will be the opening of the external auditory canal. So this is very simple. Now, in this, I would like to specifically point out one thing. In some people, there will be a projection over here, a small tubercle known as Darwin's tubercle. Known as Darwin's tubercle. It is present in some people, not all. It is present in some people, not all, and is a symbol of primitive primitive beings. So the people who have primitive traits tend to have this Darwin's tubercle. So as the evolution is going on, there is no Darwin's tubercle in most of the people these days. It is not found these days. Previously, it was there in almost everyone. So this is the pinna. This is the structure of the pinna. Now let's have a look at the external auditory canal. If this is the head, I am making the pinna like this. Here will be the external auditory canal till we reach the tympanic membrane. So till we reach the tympanic membrane. Okay. Now this external auditory canal is 24 millimeters in length. It is 24 millimeters in length and is divided as outer one third and inner two thirds. Inner two thirds. So simple maths, one third of 24, 8 millimeters, and two thirds of 24, 16 millimeters. So the outer one third of the 8 millimeter is made up of the cartilage, and hence is called the cartilaginous EAC. Cartilaginous EAC. So length of, sometimes in MCQ they can ask length of cartilaginous EAC is 8 mm. Length of bony part of EAC is 16 mm. Now, this division is very important. Why? Because here the outer part is lined by thick skin and the inner part is lined by very thin layer of skin. Why does it matter? It matters because the outer part, which is made up of thick skin, has sebaceous glands as well as hair follicles like pilosebaceous glands and other glands which secrete oil, sebum. So what happens is, why this becomes important. This is the area which is commonly involved in having furuncle or furunculosis. So whenever there is furunculosis, it is the outer one third which is involved because it is lined by thick skin which has hair follicles and sebaceous glands. So this is the part. Inner one is very thin, just a single layer, and can easily get ruptured if probed. So if you use any instrumentation over here and touch the walls, it easily bleeds. Okay, so this becomes very important. The outer one third is the one where you can find furunculosis, that is otitis externa with furunculosis. So otitis externa with furunculosis is found in outer one third. It's found in outer one third of the EAC or the external auditory canal. Clear? Now I would like one of you to focus here. However, I have not made this in the correct way, but I have still not made it straight because tympanic membrane is never straight in our body. It is placed at an angle of 45 degrees with both the planes. How? Like if I was supposed to draw it like this, it will be like this at an angle of 55 degrees, actually 55 degrees. Okay. So it's an angle of 55 degrees. So before moving to the tympanic membrane, I'll specifically pay attention to one thing, which is orientation of the EAC in our body. Orientation of the EAC in our body. Again, we'll draw the same person. Top head view. This is top of the head. This will be the nose. This will be the anterior. This will be the posterior. Now suppose if these are the ears. Here is the EAC opening. The EAC is in our body is directed in such a manner that its direction is anterior or forwards. So it is coming forward, medial. First, okay, we'll say a word and we'll go according to that. It's coming medial. Medial means towards the midline. So it comes towards the midline, medial. Then it goes forward. So it's going forward and it goes downward. Downward, we cannot see from this 2D plane. But yes, it is coming. First, it has come where medial, then it is going forward or anteriors. And then there is the tympanic membrane. So if I were to draw tympanic membrane, I will be drawing it over here. So now this is how it is oriented in our body. Medial, forwards. Okay. Then there will be tympanic membrane. Now I have a question. Can you see this through your eyes? Can you see this tympanic membrane through your eyes without doing anything? No, we can't. For viewing that, we need to bring this outer part in same line with this, right? And then only we'll be able to see the tympanic membrane through this hole, right? So for doing that, we need to pull this ear. Where need we need to pull it? We need to pull it lateral. To counter the medial part, we need to pull it lateral. For to counter the anterior or forward part, we need to pull it backward. So I'll pull it backward. I'll pull it from here. I'll pull it backward and lateral, which will now orient this in this direction. It will bring the EAC in one straight line so that now I can view the tympanic membrane. Now I can view the tympanic membrane. That is why the direction or the orientation of EAC becomes very important, because clinically you cannot examine the tympanic membrane until unless you pull the pinna, where backwards and upwards. You cannot view this until unless you pull it backwards, upwards, and laterally. So you have to do this to bring it in single line so that you can view the tympanic membrane. And what can you move? Can you move the inner bony part? Can you move the inner bony part? No, obviously not. You can only pull the outer one third, which is made up of what? Cartilage. So cartilaginous one third is what we maneuver to bring the outer and the inner EAC parts, which are bony and cartilaginous, in one line so that we can view the tympanic membrane from the pinna. Okay. So you should be looking from here. Your eye should be here. Eye should be here. So if you sit just here and try to view it, you will never be able to see it. All you will see is the posterior wall. You will never be able to see the tympanic membrane. You need to pull it and you need to be in this line. Understood? So clinically also, if you know the anatomy, even examination becomes very easy. So this is how we'll see it. Okay. Before moving even further to the tympanic membrane, first we'll take the examination part along with the anatomy. So when I am talking about examination, in ear examination, first thing what we examine will become few areas. So first thing what you have seen is pinna. You have seen the pinna. You have seen two sides of the pinna, that is lateral surface. Then you have pulled it ahead and tried to see its medial surface. This will be the medial surface. Now, while we are examining the pinna, we will also have a look just in front of the pinna and just behind the pinna. In front of the pinna, we call the area as preauricular region, and the space just behind the pinna, this space, we call it as the post auricular region. Post auricular region. So whenever you will be doing a clinical examination of a patient and examining the ear, we will always report it as first of all right and left, because both sides it is ear examination. We'll be looking and starting from pre-auricular. Then if this is the pinna, this is pre-auricular. Then we'll move to pinna. Then we'll move to post-auricular. Post-auricular. So once we are done with preauricular, pinna, and postauricular, then we'll move to the external auditory canal examination, in which we will have to pull the pinna backward, upward, and laterally to bring the EAC in one same line, so that EAC can be examined at once as well as TM can be examined after the EAC. So this is how our examination is also to be followed in this protocol. like pre, pinna, post, then EAC and tympanic membrane, and both sides to be written together so that it can be compared. So once we are done with this, we'll go to the tympanic membrane. We'll go to the tympanic membrane. Tympanic membrane. Now, when we are talking about the tympanic membrane, I would like to tell that here, tympanic membrane, as I told you, is always at the angle of 55 degrees. So first this, let's see here, if you see this is an axis, here this will be 55 degrees, 55 degrees. Just a second. Hello. Yeah, we'll continue. So this angle of 55 degrees, if you can see, it's making with the inferior wall. It makes the same angle with the anterior wall as well. So this cut section, we'll see that it is forming an angle of 55 here. Then when we draw the tympanic membrane, we'll find it will always be like this at an angle of 55 degrees with the anterior wall as well, 55 degrees. So this will be the tympanic membrane on the right side, and on the left side it will be like this. See, again at 55 degrees. Now how to determine, see, some people get confused as that why right side is drawn like this, why left side is drawn like this, why not this is left, why not this is right. Very simple thing. First of all, remember, if this is right, we are writing anterior and we are writing posterior, right? In this place we are making this as the anterior and this as the posterior. Now forget that you know that this is right side, forget it. Imagine this is forgotten. Now what happens is, if this is anterior and this is posterior, just have a look at the angle. It is making this angle where anteriorly. It has to make this angle with the anterior wall. So it is making 55 degree with the anterior wall. So you are examining the patient in such a way. Now try to imagine the head of the patient. This is the head of the patient, right? This is the patient. And again, I'll draw the patient here. Okay. Now see, with the anterior wall, it will make an angle of 55 degree with the anterior wall. So it has to go like this on the right side, and again 55 degree here. It will go like this on the left side. So right will always be like this, tilted towards anterior side on the right. Again on the left also it will be tilted toward anteriors, but anterior will be facing the opposite side in left case. So the shape, or I'll say the orientation, becomes very easy. So whenever you see a diagram of tympanic membrane formed like this, you should know that this is the right side without even having a doubt, and you should know that this will be the left side. So there'll be no doubt about it. You will never go wrong about this if you imagine the face of the patient attached with it, and remember the one simple fact, which is it is forming an angle of 55 degrees with the anterior part. So it is bent anteriorly at an angle of 55 degrees. And here also, if you imagine the face of the same person whom you are examining, you will never go wrong with deciding that which side tympanic membrane it is. So this becomes important even in exams, even for your MBBS exams. This is important because sometimes people will draw the tympanic membrane in the wrong direction. Sometimes you are asked a question, draw a completely labeled diagram of tympanic membrane, and you end up drawing, suppose they have asked, draw a completely labeled diagram of right tympanic membrane. You draw it perfectly, you label all the parts, but you end up drawing it like this. It becomes wrong because this is which side, this is left side, because you will remember that the face of the patient whom you are examining, this is forming an angle of 55 degrees anteriorly, so hence it has to be left, not right, and here you will lose marks. So don't make this mistake ever. So just based on the anatomy, just based on the anatomy, you'll be pretty clear about this. Okay, so moving on to tympanic membrane first. So the tympanic membrane, I'm drawing the right side so that we know, we are clear about that. First of all, I have made a bone. Now I'm making the tympanic membrane. Tympanic membrane has two parts: pars flaccida and pars tensa and pars tensa. So here, first of all, tympanic membrane is thickened peripherally. Here it is thickened. Peripherally, it is thickened across all sides. That is posteriorly, this is posterior, right? This is anterior, anteriorly. It is thickened to form annulus. To form annulus. This is called the annulus. Now this annulus is resting in a sulcus here in the tympanic bone. This sulcus is called as the tympanic sulcus. This sulcus is called as the tympanic sulcus. So till now it's very simple. Tympanic membrane has two parts, pars flaccida and pars tensa. This is the first, this is the second. Tympanic membrane is thickened circumferentially, which is very easy to remember. To form what? It forms annulus. Now, this annulus sits in a groove in the tympanic bone. This groove is called the tympanic sulcus. Now, if you see superiorly, this is anterior, this is posterior, we know. This is inferior, so it is lined and thickened inferiorly also by the annulus. But superiorly, it is dehiscent. Superiorly, this thickening tends to come centrally and attaches itself to the lateral process of malleus. So this is handle of malleus, this is lateral process of the malleus, here will be the head. So it attaches to the lateral process of malleus. This attachment gives rise to these two bands running in between and dividing the tympanic membrane into two. So the tympanic membrane, which is here and is lined on all sides by the annulus, is what we term as the pars tensa. So this part of the tympanic membrane is pars tensa. So if somebody asks you what is pars tensa, pars tensa is part of tympanic membrane lined by the annulus on all sides, and superiorly lined by this part of the annulus, which is again nothing but the same annulus thickened, coming centrally to attach to the lateral process of malleus. See, it is attached to the lateral process of malleus, right? So these two bands are then termed as, this is, you remember, this is which side? Anterior, and this is which side? Posterior. So this band is termed as anterior malleal fold. Anterior malleal fold. Now this part, the band behind, is termed as posterior malleal fold. Posterior malleal fold. So pars tensa is bound on all sides by the annulus, the anterior malleal fold, and the posterior malleal fold. Correct? This is pars tensa. This is the major part of the tympanic membrane, and this is the part which is responsible for hearing mechanism. This part vibrates. This part is attached to the handle of malleus, which helps in passing the vibrations to the ossicular chain. And further about that, we'll read later. But for now, we should understand this pars tensa is responsible for hearing, and this is the pars tensa. Now, this is just one part. Let's see the other part. So this we have made as the past tensa. This bony groove will be tympanic sulcus. I'll just make the thickening. This will be PML, posterior malleal fold. This will be AML, anterior malleal fold. The circumferential thickening will be called as the annulus. This will be called as the annulus. Now we have a triangular area which is deficit and does not have annulus. This is deficit in annulus. There's no annulus, right? So there's no annulus here. This part is called as, this part is called as the pars flaccida. This part is not responsible for hearing. It is not, remember, this is not responsible for hearing. Pars tensa is the one which is responsible for hearing, and it is not bound by the annulus as well. Okay, now we'll go ahead. So we'll go ahead and continue this. This over here is a bony gap, you can say, which is forming a sort of notch. This is forming a sort of notch. This part. That is why this is triangular here, right? It's like this. This notch is called the notch of Rivenus. Notch of Rivenus. and can be asked in the MCQs. This can be asked in the MCQs. This is the notch of Rivenus. Okay. So this is about the tympanic membrane. So we are doing right now only the basics. We are not going into the details because we want a quick intro where you at least get oriented to the subject, at least oriented to the anatomy, so that when you try to read, you can correlate the diagram, you can correlate the orientation, and you can quickly form an image in your brain so that it becomes easy for you to understand ENT. And once you understand ENT, questions will become very, very, very easy. The questions will become very, very, very easy. Okay. So moving ahead, the tympanic membrane actually has three layers. Has three layers: the outer, the middle, and the inner layer. And the inner layer. Okay. This has three layers: the outer, middle, and the inner layer. See, these three layers also, when you try to imagine, will become very easy for you. So this is pinna, this is external auditory canal. Okay, great. Now this is the tympanic membrane. I'm making it straight here just for making you understand. This is the external auditory canal. Inside of it, here is the middle ear. Here is the middle ear space, right? See now, if you just look at this diagram only, you will always remember that tympanic membrane has three layers. Now, what are those three layers? First of all, pinna is covered with skin, so is the external auditory canal. So it is covered with skin till here, till here, till here, and the skin continues over the tympanic membrane. Though it's not called skin here, but the layer continues here. The squamous epithelium which is covering this is continuous with the tympanic membrane. So the outermost layer is nothing but the continuation of this epithelium over here. So this squamous epithelium forms the outer layer of tympanic membrane. So this blue layer which we have made is nothing but one of the layers. This is the first layer or outermost layer of the tympanic membrane. Similarly, as we have made it outside, here inside, this middle ear is covered with mucosa, and this mucosa goes and covers the tympanic membrane as well. So the innermost layer of the tympanic membrane, this third one, is nothing but continuation of the middle ear mucosa, is nothing but the continuation of the middle ear mucosa. And in between is the fibrofatty tissue, where there will be connective tissue. In between, this is the second layer. This has fibrous layer. I'll write it. Actually, this is fibrous layer. This has fibers. This also has the neurovascular bundle. Basically, this is responsible for the blood supply of the tympanic membrane. So these are the three layers: the one outermost, the middle, and the inner. Okay, clear with this? Now we have read three layers. Now in the middle layer, the second layer, which we have called as the fibrous layer, there are fibers. There are fibers which run in different directions. So if we are creating this as see outer layer, I am creating this as the middle layer, and this as the inner layer. This middle layer is made up of fibers, and in this also, first of all, I'll draw the pinna so that you always remember this is outer and this is inner. Now see, in between this middle layer, from outer, within this, the fibers which are here are outermost fibers, and the fibers which are here are innermost fibers. So the direction and orientations of the fibers is different from here, outer to inner. How does it go? First outer, it is in radial. Then concentric, or you can say spherical. Later, as it reaches the innermost part, it becomes haphazard. Not haphazard, actually, we can say it becomes like this. This fibrous layer is very thick and important, and plays a very important role in vibrations and in hearing mechanism. Now, how does this happen and how does this take place? That we'll read later. But this also defines how the sound travels based on the direction of the fibers. Okay, that how the sound will travel. Now this middle layer is very thin or deficient or not present, you can say, in pars flaccida, and hence the pars flaccida is not responsible for conducting the sound. It does not conduct or pass on the vibrations, which this usually does. Okay, so this is the tympanic membrane. So before moving to the middle year we will start in the next class, basic only. But tympanic membrane, one concept I leave you today with the tympanic membrane before going to the 5 MCQs which we'll discuss today, or which I'll give you, and one question. Whosoever will answer that question in the comment section will get their name with the credit on the social media platforms of Nextillo. The wonder has a name, because we'll appreciate if you answer the question. So coming to the tympanic membrane, if I am drawing it like this, there's a concept which might be helpful for you all. Okay, so here will be the lateral process of Malleus. Then here will be the handle of Malleus. Then this point is called the umbo. This is called the umbo. From here, whenever we examine the tympanic membrane, we can see a cone of light in the anterior inferior quadrant. In the anterior inferior quadrant, this cone of light helps us in telling that the orientation of the TM is normal. Orientation of tympanic membrane is normal. Whenever this tympanic membrane will either be bulged or retracted. See, either it will be, if you see it like this, either it will be pushed out or sucked in. In both scenarios, this cone of light will be lost. This cone of light will be lost and will not be present. But now, how do we know which quadrant this is? So to define quadrants, we'll make imaginary lines. How we'll make the imaginary lines? Now see and follow. We draw a line going through the handle of Malleus. So we draw a line going through the handle of Malleus. These quadrants we are just considering for the past tensa, just considering for the past tensa. Now again, from the umbo at 90 degree with the first line, a line passing through the umbo, we draw it over here. So this divides it into 4 quadrants. Quadrants are always 4, so 1, 2, 3, 4. Now, as I have drawn this tilted towards this side at 55 degrees, this is representing which ear? Right ear. This is which side? Anterior. This is which side? Posterior. This here will be superior. This will be inferior. So the naming of the quadrants is very simple. This is antero superior quadrant. This is antero inferior quadrant. Similarly, this is postero superior quadrant. This is postero inferior quadrant. Very simple. So this concept is very simple. These are the quadrants, and this cone of light is seen in which quadrant? The antero inferior quadrant. This is how it looks normally. Okay, so this is very simple. Now the concept with which I want to leave you all, which is not related to the anatomy but will help you later in reading the diseases as well. If there is a perforation anywhere which has normal pars tensa all around it. So this perforation has normal pars tensa all around it. Can you see? This is one perforation. This is other perforation. I'll make another tympanic membrane over here. Suppose I make this big perforation. But again, you see, there is normal pars tensa all around the perforation. Whenever there is normal pars tensa all around the perforation, it is called a central perforation. Irrespective of the fact that this is located anteriorly, it is always called as a central perforation. Now, if you see here, this part is not surrounded by normal pars tensa, and hence this is called as marginal perforation, not central perforation. Now this is a central perforation, everybody knows that. Now the size of the perforation, it's either small, medium, large, or subtotal or total. See, total everybody knows. This is a total perforation. Okay, that's a total perforation. Now, what is subtotal, what is large, what is medium, and what is small? This is a subtotal perforation where this is subtotal, yes, yet this is central subtotal perforation, where still we can see normal pars tensa all around the perforation. So this is that. Now, small, medium, and large are the ones where people usually get confused. So I'll make 4 examples side by side so that you people understand this. I'll make the quadrants also. Here will be the umbo. Now, if a perforation is involving only one quadrant, it is called small. If the perforation is involving only one quadrant, it is called small. If the perforation involves two quadrants, it is called medium sized. It is called medium sized. If the perforation involves three quadrants or more, it is called large. But remember, these are small central, medium central, and large central because there is normal past tense all around. Now the question arises, if suppose there is a perforation over here of this size, it is involving two quadrants, but does it appear to be medium sized? No. So this is again small sized central perforation, because we do not mean that it should involve only one quadrant. We mean that a perforation equivalent to the size of single quadrant is small. A perforation equivalent to the size of two quadrants is medium sized, and a perforation equivalent to the size of more than two quadrants is large. So if you get, suppose, a picture where it is like this, and this is the umbo, and the perforation is just here involving three quadrants, but you can see this is equivalent to the size of one single quadrant. So this I will label it as a small sized. This is the correct way of writing the perforation: small sized central perforation. Small sized central perforation. And this is where we'll end today's class. And next session, whenever we'll take the next lesson, live session, we'll do the middle ear anatomy. And trust me, that anatomy session will be good, because middle ear anatomy is where we need our concepts. Until unless we'll have a concept of middle ear, we'll never be able to understand middle ear or do or solve the questions related to the middle ear. So now, uh, I'll post a few questions, a few MCQs. A patient, a patient is having ear discharge for 10 years, for 10 years. Now he has developed severe pain. Now he has developed severe pain. There is suspicion of intracranial complication. What is the investigation of choice? What is the investigation of choice? Options are PTA, X-ray, mastoid, EEG, CT scan, or autoendoscopy. First of all, let's see what they have asked. They are giving us a case where patient has ear discharge. It has been there for 10 years. So this is a case of CSOM where a complication has occurred. The patient is having severe pain and we are suspecting intracranial complication. So in your brain, make a picture that from ear the infection has spread to the brain. It will either go through emissary veins or it will go by eroding the bone. So if there will be erosion of bone, will it be seen in PTA? No. Will it be seen in X-ray mastoid? Yes, can be, but not sure. You will not be able to make it. You will not be able to identify it correctly, like where the bone has been eroded and how much. Will EEG tell us? No. CT scan. So the investigation of choice here becomes CT scan, and the correct terminology we should use is HRCT, high resolution computed tomography of temporal bone. Okay, this is the answer. Okay. So next question. Epstein-Barr virus. Epstein-Barr virus is related to which tumor? Your options are carcinoma tongue, nasopharyngeal carcinoma, then post-cricoid growth, then uh, parotid tumor. Okay. The answer over here will be nasopharyngeal carcinoma. See, this question can be framed in many other ways. Suppose there is suppose there is one primary of unknown origin. Primary of unknown origin cancer. You find neck nodes. You do biopsy, you take out samples. Now you send for few tests where you see it comes positive for human papilloma virus or Epstein Barr virus. Either human papilloma virus or Epstein Barr virus. If it comes positive for human papilloma virus, it is mostly involving oropharyngeal cancers. If it comes positive for Epstein Barr virus, it is mostly involving nasopharyngeal cancers. So, human papilloma virus in cases of oropharyngeal or oral cavity, Epstein Barr virus for nasopharyngeal cancers or nasal cavity. So, this you have to remember. This will be very important if it comes in the exam. So, this way you will have in your brain, if you keep this, this will help you in many MCQs, in solving many MCQs. Okay. Now, next question. Thumb sign. Thumb sign. Thumb sign is seen in which of the following? Retropharyngeal abscess, acute epiglottitis, pharyngeal abscess, Ludwig's angina. So the correct answer over here is acute epiglottitis. The epiglottis, once swollen, because it is here attached to the thyroid, like this. Once it is swollen, it looks like the thumb. Have you seen the thumbs up sign? It's just like that. So it looks like a thumb. Hence, it is called the thumb sign. So it is seen in cases of acute epiglottitis. Now, this is very important. I am leaving you with a question that involves anatomy. The answer to this I will give in next class and we'll announce who answered it correctly. It's up to you. You read. After reading, answer it over here. But I want you people to answer it. There is a canal called as Dorello's Canal. Dorello's Canal. My question is, which cranial nerve passes through the Dorello's Canal? Which cranial nerve passes through the Dorello's Canal? Which cranial nerve passes through Dorello's Canal? This has got huge importance in one of the very important complications of CSOM and one of the syndrome. So we read syndromes, we read the symptoms, we know that there will be three things. Now, why those three things? The answer to that is the anatomy, and that anatomy lies here in the Dorello's canal. So I just want you people to answer which cranial nerve lies in the Dorello's canal. So go to the comment section, leave your answers, find it, Google it, but read about it. Once you read it, read its uh, implication. Why I am giving you this Dorello's canal? What is the other name of this canal? Which ligament is involved? Which cranial nerve? What it causes? And it is involved in which complication and which syndrome? What I am talking about. So By next class, I'll let you know. For today, I think this is it. Thank you for joining. Hope you learned something in a fun way, and most importantly, you made a concept. So now you, whenever you see the ear, you always have a few things in your mind. The 55-degree of the tympanic membrane. Then you also have in mind the medial and forward, how the EAC is there in our brain, in our body, like why we have to pull it backward, lateral, and outwards to view the tympanic membrane so that this comes in a line. So, because once the anatomy will be clear, once the concepts will be clear, it will be very easy for you people to understand and learn and to solve the MCQs. So, that's it for today. Bye bye. Till the next class. We are always there to support you at Nextillo. The wonder has a name. Thank you.